guys, this is Carly with Luxury Laser Education, and I'm one of the instructors here. And today we are going to show you how to do a needling demo. So let's go over the tools we need to do this treatment. Michelle's face is already cleansed, so the products that I need are some gloves, your pen and a pen tip, and we will go over the different types of pens that there are, your BLT, which is your lidocaine to numb the face, 70% alcohol, a sharps container, which is to dispose of your needle afterwards, also a post-procedure sunscreen. Today we're using the Skin Medica line. You want to use something post-procedure so that there's no pain putting the product on afterwards. And then also today we're going to use Saline Solution. There's multiple different things you can use to plunge in the skin, and every state is a little different with their laws. But we're going to use Saline Solution because it's a really nice and minimal treatment. Alright, so we're going to start out by numbing her face. So I have the BLT, and I'm just going to put it over her skin, smooth and evenly across the whole face. This is going to sit on her skin for about 15 to 20 minutes. Alright, Michelle is feeling numb, so we're going to get started. I'm going to spray some 70% alcohol on some 4x4s. And I'm going to use this to prep her skin and also get the numbing solution on. Again, the numbing you can put on really thin, so it doesn't take much to get it off. And also the alcohol is a little strong, so I like to give them a little bit of air in between, especially right under the nose. And that quick break really helps a lot. Alright, so she's ready to go. So what I'm going to do is put my pen together. So I have my needle tip. Don't open your needle tip until your client gets there. One, I think it looks really good to open it fresh in front of them. Also, if they don't show up and your needle tip is open, you do have to throw it away because it is then considered dirty. So I'm opening it up. There is a seal on it as well, and that's going to plug right in to my pen, and it clicks in and turns to the left. So the pen brand that I'm using is the Derma pen. There's multiple brands out there that you can use, and they're all awesome. There's the micro pen, there's the skin pen, again we have the Derma pen, and they're all very similar. They have 12 tiny micro needles in them that vibrate up and down while we resurface them back and forth. So we'll give you a close-up as well of the needle tips, and that way you can see the way that they move. The setting that we're going to use on her face is a 0.5 starting on the forehead. I like to use a 0.5 on the forehead all the way around the occipital bone and underneath the eye. I also keep a 0.5 on the nose just because there's not as much tissue there. Once we get to the cheeks and the chin, I'm going to knock it up to a 1. If people have really deep fine lines, which Michelle doesn't, or if they have really bad acne scoring, which she also doesn't, then after I did all of that pass, so the 0.5 and then the 1, I would go back and hike it up to a 1.5 and just go in that area for a small pass over as well. Alright, so I'm going to start with the saline. I squirted it onto the cotton and I just put a full pass on her forehead. And I like to use the medicinal pillowcases, that way I can kind of use it as a little table for me. So I have it at the 0.5, I'm going to turn it on, and I'm going to go back and forth and basket weave, no pressure at all, and I'm going to do about 6 passes, so I'm going down, up, right, and left. And again, I'm going to do that about 6 times or until I see a good reaction. A good reaction would be a slight pink. Some people get red really easily, and that's okay. But you do want them to be a little pink, and some people get more bloody than others, and that's just fine as well. You feel okay, Michelle?
It does, just fine.
Okay. Alright, so I'm going to add some more saline to the right side of her forehead and keep going. The forehead is the area that the client is going to feel it most on the face, just because there's not as much tissue and it's a very bony area. But really it just feels like a vibration from the pen. They don't really feel the needle tips because they're numb. All right, just going to finish the left side of her forehead. All right, so now I'm going to start under her under eye. I like to do the under eye again at a 0.5, and I like to do little circular motions all the way around with no pressure at all. And what this is doing, it's creating a wound healing response. So as the teeny micro injuries are plunging into her skin is going to re-heal thicker, firmer, tighter, and it's going to really help build the collagen and elastin in her skin. Again, you can do this for any texture issues, whether it's acne scarring. We do a lot of tummy tuck scars, breast dog scars. You can even do it on stretch marks, especially if they're already clear. If you don't have a laser, then you can do it with a stretch mark removal, with a micro pen or a dermapen, any needling device, and you can use like a brightening cream with it to pull the pink or purple out, or a scar recovery gel. Otherwise, there are lasers that are really good for stretch marks as well. And you really want to get right under the under eye. That's kind of the most common area that people really want done. So don't be scared to get all the way there as long as you're gentle. The chin and lip area are really important as well to do. As we age, we do get fine lines in our upper lip and in our chin. Sometimes they call them smoker's lines or coffee lines. This is a really good treatment that we can reach those lines, because with laser sometimes we can still do it, but it's a little harder just because some people have really teeny top lips and it's hard to reach the area. So this would be a really good treatment for if that's anybody's main concern. So same thing, do about 6 passes. And with the top lip, I do only go one direction just because that's all that's really going to fit in there. And I'm not going over the pinks of her lips, just on the upper lip, right under the nose. And then also you can focus on marionette lines if that's people's concern. If people have smile lines, which are the lines that go here. And also this is a great treatment to partner with fillers, because if you think about getting a brand new car, you want the exterior to look nice and the interior to look nice as well. So they're really great for both. All right, we'll move to the other side now. All right, we're gonna do the other side. So we just finished the pass of her full face. I'm going to take a clean 4x4 cotton with some saline on it and just wipe everything off, any excess blood, or if there's any numbing cream, anything like that. You can also do a cleanse if you'd rather do that. Just be really careful with what products you're using, because you don't want to penetrate anything into the bloodstream that shouldn't go. So just make sure that you're educated on that. And then after that, I'm going to put a tinted post-procedure sunscreen on. Again, we're using Skin Medica. So I'm going to put that on her face so that she can go outside into her car. And the client is going to want to stay away from any exfoliants or scrubs for about 2 weeks. Avoid sun exposure for 2 weeks to a month, and wait to put makeup on for at least until tomorrow. She can wash her face tonight, but just a really light sudsy cleanser would be recommended. But she's gonna love it. She'll be a little red today. Tomorrow she'll look awesome. She'll feel really nice and tight. This procedure, I recommend people do at least 6 a year. You do a month 1, 2, 3, and then you start going every other month, and your skin will start to get used to it, slow down, and you'll start to see the anti-aging process even after the first one. It's really amazing. Also, once you're done with your treatment, you do want to make sure that you are following safety in your sanitation. So make sure that you wipe everything down with Cavicide wipes. Your needle tip goes into the sharps container, and you want to wipe down everything you touch. So from the bed to the pen cord, the saline, any wash that you used, every handle and everything. If it's a hot towel cabbie, you need to wipe everything down because there is blood exposure. Thank you guys for watching this video. This is Carly, one of the instructors at Luxury Laser Education. Today we did the microneedling treatment, and again, you start out with a cleanse, numb the face for 15 to 20 minutes. Then you start the treatment with Saline Solution. Then you do wipe it all off, put the sunscreen on, and then make sure your safety and sanitation is all good to go. Feel free to subscribe to our channel and follow us on Facebook and Instagram at Luxury Laser EDU. Also, if you'd like to inquire for school or any of our services, it's at luxurylaseredu.com.